Hello, Dr. Chauhan. Welcome to Slovakia.
Hello, thank you very much. Thank you.
Today, I would like to ask you something about your experience with diabetes and what herbs can help in this
Yeah.
common disease. Probably you see it in India also.
Yes, this diabetes is a very common problem nowadays. Everybody, you see in every house, there is a problem. And the main reason is the lifestyle. We see the lifestyle has changed a lot in recent years, from last about 20, 30 years. People are consuming a lot of carbohydrates and not exercising. It is a metabolic syndrome. In metabolic syndrome means when the metabolic rate goes down, and you are developing so many complicated diseases because of the too much accumulation of fats in your body. So usually it is because of the blockage of channels, flow of energy, because of the deposition of fats in our organs, especially the liver and around the pancreas, around our under our skin and around our organs. So if we are consuming too many calories and not exercising and not melting the fat, the organs become clogged, and the insulin which was being produced by the pancreas, it is facing the resistance. It is actually is the key. The insulin which is released by the beta cells of pancreas, it is a key to the cells. Whenever we eat sugar, whenever there is too much sugar in the blood, the key opens up the channels, the door opens up of the cells, and the sugar goes in. But if there is too much sugar, regular consumption of sugar or the carbohydrates, then the key is not working, and the insulin is not enough. The there is insulin resistance. Enough insulin is produced by the pancreas, but it is not opening up these channels of the cells, and that's why the blood sugar level in the blood, it increases, and then it can lead to a lot of problems, and it can lead to muscle loss, it can lead to heart issues, it can lead to eyes issues, it can lead to kidney issues, and all the organs they are suffering from because of this diabetes.
Do you see many patients in India these
Yes, I
days?
am. I am practicing in India in Chandigarh from last 25 years, and Chandigarh is a beautiful city in north part of India, and it's capital of a state called Punjab. And you know, diabetes is prevalent all over the affluent societies of the world because of too much food and too much carbohydrate-rich food. And India is now becoming the capital of the world for the diabetes, and especially this Punjab state, our Punjab state, where people consume a lot of carbohydrate-rich diet, is capital of diabetes of India. So Chandigarh is a affluent society. People eat a lot of rice. People eat a lot of chapatis or the wheat and bread. So a lot of carbohydrate, and also the American food, European food, and Indian food all together, leading to and sedentary lifestyle. This
So,
is a
what do you
complication.
do with these people?
I tell them to exercise, drink more water, and gain the muscles. So if you are having less muscles and more fat in your body, then you are supposed to get diabetes. So because too much fat in your belly, if you are having belly and you see belly, that means you are prone to diabetes. So you must take care of your belly. It should be flat. You don't see any speed breaker when you put your hand like this. There can be big speed breaker in some people. So there should not be speed breakers. It should be flat. So because if there are speed breakers, that means there is clogging of the flow of energy, and the fat is deposited around the pancreas, and the visceral fat is the main culprit. And I am telling them to exercise, drink more water, avoid carbohydrate rich food, and people they want to use medicines, and so I prefer these natural medicines, natural herbs which are growing in the fields of Himalaya or secluded places. I take those herbs and I make special products with standardized extract. I don't use the herbs as it is. I standardize them so they are more effective and they work very quickly. So this is what I use
And
in
what
my
are
clinic.
the herbs that helps best in this case of
All
diabetes?
the see, according to Ayurveda, it is a disease of sweetness, too much sweet. When we are consuming too much sugar, too much Carbohydrates are also sweet. These bread and these chapatis and rice is also sweet. So when we consume too much sweet, we need to consume bitters. But bitter nobody is consuming. So we have this fenugreek is a powerful herb. The seeds of which I am using, and I'm using the herbs in combinations. 4 or 5 combinations are there. I'm using all of them together. So fenugreek is the seeds of fenugreek. They are rich in a chemical compound or alkaloid or saponins called. It's called diosgenin. Diosgenin it stimulates the pancreas to make more insulin, and also helps beta cells to recover. And this diosgenin is helping the pancreas in a way to work more efficiently, and helping it to work properly and make more insulin, and also reducing the inflammation. And this is also opening up the channel. It has isoleucine compound, which is actually a amino acid. Isoleucine, most of the gym goers, they are using isoleucine as a protein to for muscle recovery. So it helps to build up the muscles. So in order to build the muscles, we definitely need natural sources of isoleucine. So this is one of the best sources, and also has galactomannan. Galactomannan is a fiber which is stopping the absorption of glucose in the blood. If you are eating too much sugar, this galactomannan in this fenugreek, it can help to reduce the quick absorption or the quick spike of the diabetes or the sugar in the blood. So these are the herbs which are working in a very natural way to stop the spikes in the sugar in the blood. But this is helping in this way. But that doesn't mean that if you have fenugreek, you stop exercising, or you stop if you keep consuming more sugar. So it is better to avoid sugar. And now there is another herb called Gymnema Sylvestre. In Ayurveda or Sanskrit, it is called Gurmar. Gurd means sweet, and Mar means to kill the sweet. So it has active alkaloids like gymnemic acids, and I am using very standardized extract of this Gymnema. And gymnemic acid, they bind with the sugar molecules in the intestines whenever we eat sugar, and if we eat this, and the sugar will not be released quickly, and will not be causing any spike in the sugar. So it is better not to consume a lot of sugar, but if you have consumed by chance, by mistake, or by because your tongue wants it, so you must consume this Gymnema. And this gymnemic acid, they slow down the sugar absorption. And similarly, there are other vegetables and simple green leaves which you should consume. Simple green leaves can also help to reduce the spikes in the sugar. Always consume salads rather than these rice and wheat, or these grains which are refined, and they are cleared from their natural minerals like magnesium, iron, and zinc, and such minerals are there in the wheat and also in the rice. But we clear them, make them refined. So, and the other, this is a tropical fruit. In fact, it is called Karela or Mambordica charentia. So this is a very bitter fruit. So, but in India, people drink the juice of this. The diabetic people, they drink the juice of this, and they make a lot of faces because it's very bitter. And it has a compound called alkaloid called charentin in it, because, and also chromium, which is very much needed by the diabetes patients. So chromium is needed for better sugar control. This charentin is helping the insulin to work more efficiently, is also opening up the channels just like insulin. So it has structure just like insulin, and it works like insulin, and so it can mimic insulin just like that. So we are working on diabetes at various levels, working like insulin, stimulating the pancreas, reducing the inflammation, improving the muscles, and also reducing the absorption of the glucose from the intestines, and also working on our lifestyle. So we have another product here. It is Diableen. All the products, they are standardized extracts free from any heavy metals, free from chemicals or starch or some fillers or some taste maskers or any colorful capsules. No. So even the capsule shells, they are very transparent and natural. So this Diableen is combination of this Fenugreek, this Gymnema, this
Karela.
Karela, these all three in one when the sugar levels are not so high. So if the sugar levels are high, all of them can be used along with
What
Diableen.
means high?
High means when the sugar is not in control.
What's in numbers, for example, if you
In India, the numbers is around 250 milligram per dl. Is like here around 7 or 8.
7 or 8
Yes,
is high already.
yes, already high.
Okay, so this is
So
up to 7. You can
up
just
to
take that, for
7,
example.
up to 7 you can take these. Up to 7 you can take Diableen alone, and if you have more diabetes, then you can add 1, 2, 3 depending on the sugar levels. So you can start with, and there is another herb called curcuma longa or turmeric. This is a spice. It's very powerful anti-inflammatory, anti-diabetic, antihistaminic, and it's very good for the skin also. So this curcuminoids, they also work like opening up the channels, stimulating the pancreas to release more insulin and help in diabetes control. The curcuminoids also help to lose weight and also burn the fat cells, and by stimulating the metabolic rate, because it increase the digestive fire, increase the metabolic fire, increase the metabolic rate also. So yeah, you can also take a slice of curcuma raw herb you have here, curcuma,
Maybe in some shops, yes.
raw herb, or ginger.
Ginger.
So these rhizomes, so curcuma or ginger, turmeric and ginger, you can take small piece of it and consume every day in your life. So just stop consuming those what do you call a lot of carbohydrates. Just stop it. These cakes and pastries and these sweets. So and also incorporate exercise in your life. So and now coming to this another product called Kapha balance. This has its roots in Ayurveda. Ayurveda says that diabetes is caused to those who are not exercising and who are eating a lot of food. That is a simple cause. It is similar to what modern doctors are saying. So ancient doctors, modern doctors, ancient science, modern science says the same thing. If you are just sleeping, lying on the bed, lying on the couch, watching TV and drinking beer and having a lot of sugary food, and then you are about to get diabetes or such diseases. So in that is called kapha. According to Ayurveda, that too much of accumulation of fats is called kapha. So kapha can lead to blockage of channels and interrupt in the flow of energies. So we need to control the kapha. We need to do kapha balancing, and exercise is the best way. And we have this herbs like curcuma is also kapha balancing, ginger is also kapha balancing, and we have rare herbs here which are hardly used by any modern herbalists. But this is very ancient formula I found in my ancient texts. So I was looking for new, stronger formulations. Then I found that this can work for obesity also. This can work for fatty liver also. In overall, increasing the BMR. So we don't have usually how we are finding how to increase the BMR. We are finding the ways, but this is the one which can help you in increasing the BMR. So if you increase the BMR, you increase your removal of toxins from your blood, reduction in the this sugar levels. So it has this herbs like chironji or Buchanania latifolia, Hedychium spicatum, and then there is Piper longum, long pepper, and then there is Clerodendrum serratum, and this Curcuma geodaria. This is another variety of curcuma. Curcuma longa is curcuma or turmeric, but Curcuma geodaria is something similar species, different functions, and helps in diabetes control by stimulating the pancreas to and also opening up the channels which are blocked due to excessive fat. So this is how we are helping our patients in India. And of course, as I told you, exercise, drink more water, sleep well, because if you don't sleep, then there will be imbalance of Vata energy. Vata is air and space element, and then you will have more diabetes, because diabetes is complication of Vata. So according to Ayurveda also, sleep is very important, exercise, enough water, nutrition. This is also providing nutrition. These herbs, they are full of antioxidants. We need anti-inflammatories. These are anti-inflammatory herbs and anti-diabetic also, and also helping to reduce the inflammation. So this is a multi-dimensional approach
Yes,
we need.
it's very exhausting answer. Thank you for your approach to diabetes in Slovakia also.
Thank you very much.